Hi, and welcome to today's SFPE webinar on COVID-19 and fire safety engineering, impact on fire safety and lessons learned for future pandemics. This is Maggie Mojab, SFPE event manager, and I will be moderating today's webinar. Before we get started, I'm going to go over some information in regards to the webinar logistics. First, all participants will receive a certificate of attendance for 1 PDH. To receive a certificate, you must stay online for the entire webinar. Certificates will be sent out via email in about 1 week. Also, we do not provide copies of the speaker's PowerPoint presentations. However, we will be posting a video of this presentation on SFPE's YouTube channel and website in the next week. Additionally, you can ask our speaker questions by writing it in the webinar dashboard. You may ask a question at any time. However, we will not be taking questions until the end of the webinar. Today's speaker is Paulo Ramos. Paulo Ramos is a fire safety specialist at ATU Fire Safety Consultants, Portuguese fire safety engineering company, and president of the SFPE Portugal chapter. He has a master's degree in architecture and a postgraduate studies degree in fire safety design. Currently, he's doing a PhD in fire safety engineering at Coimbra University. He is a member of CT46 Standardization Technical Committee, presiding the SC6 Fire Safety Engineering, which is the Portuguese organism that works with the ISO TC 92 Fire Safety. He is the president of the Fire Safety Committee of Ordem dos Arquitetos, the Portuguese Architects Charter Association, and Paulo has also been the author of more than 300 fire safety projects in Portugal, Angola, France, and Algeria. So with that being said, please help me in welcoming Paulo.
Hello, Maggie. Maggie, thank you for the introduction. Congratulations, you have a wonderful Portuguese accent. So you spell it very well, my name. And I would like to welcome everyone that is attending this presentation. It's a pleasure for me to share my thoughts on this. And I will gladly answer all the questions you may ask. Okay, so let's get started. Sorry for my terrible English accent, but it's the best I can do. So I'm going to start with a very boring disclaimer notice. I am not a doctor, nor virologist or public health specialist. My goal is not to give advice on the control of COVID or prevention of COVID disease. This presentation is based on data collected until 30th of June, so 6 days ago. And the opinions that I express in this presentation are my own. They do not represent necessarily SFPE Portugal position, nor I intend to be spokesman of any of the work groups in which I collaborated about the COVID-19. So with that being said, I'm going to start trying to put things under perspective and to see how serious it is, fire comparing to COVID. This is a graph with the number of deaths since the beginning of the year until June 30. And we can see that fire has caused so far 62,000 deaths and COVID more than 500,000. So it means 12% of the deaths comparing with COVID. But the thing is, eventually this simple comparison could make us neglect the fire safety during pandemics, but one must take into account that the only metrics to compare something that is bad is not only the death toll, it's also important to take into account other problems like property loss, etc. So, and anyway, I think that's a goal for all of us. No one wants to that the number of deaths due to fires increase during a pandemic is just to add another problem to the equation. And I would like to make a brief background of this presentation. I participated in a Portuguese work group on the impact of COVID in fire and security industry. This work group had stakeholders from all areas, basically, and I was in representation of the fire safety engineering from practitioners of fire safety engineering. But the focus of this work group were indeed the post-COVID environment and not looking to the present, but trying to take some lessons to the future. And we produced a public document that was disseminated in the Portuguese technical community. This is below here in the right corner. One of the images of that document. I also participated in a SFP European chapter leadership meeting that we scheduled just to discuss the impact of COVID in Europe and to share our experience from different countries, that we live this very differently from country to country. So this was also very important for preparing this presentation. And we also had in Portugal a seminar, webinar to be more precise, to discuss the impact of COVID in firefighting. So we had a lot of webinars about COVID, but this one, it seems that it was worth mentioning. And part of what I'm going to present is a result of clients' consultancy and listening to their concerns, and I'm going to show two stories about problems that my clients phoned me about. So to begin with, I'm going to talk about one of these experiences with one of our clients. This building here, it's a 18-story office building with roughly 1,500 occupants, and the employees, due to COVID, didn't want to use lifts, nor they didn't want to use touch on door handles. So they asked for to put wedges holding the doors, but the company asked us solutions to avoid these because they would know that this wouldn't be a good solution in case of fire. So this was what the employees wanted. This was the solution that our client had, but he had some doubts because it will have to screw this plate in the door to hold this door pedal, and they were afraid this could jeopardize the fire rating of the door. There were some other solutions like an opener handle. You can see here how it can be used. And our solution was quite simpler than this, to put hand sanitizer in both sides of all doors. So people would be able to do hygiene and disinfect hands after touching the handle. So this was the first concern we had from a client, and this was like 1 or 2 weeks before lockdown in Portugal, before confinement. The second story is during the confinement. I went to visit a building. You can see here the cross section of this building. I went to make a technical visit for technical due diligence in an 8-story building, 400 occupants, non-sprinkler office building. And at that time, during confinement, there was a very low occupancy load. Just 10% of the employees were there. All others were home working or remote working, as you prefer to say. But the thing is, all doors in the building from basement to top were wide open with wedges in all doors. So the whole building became just one fire compartment, a huge fire compartment. And the thing is, if we had a fire in the basement, the smoke would spread till the last floor through the stairwell. So it would use as a channel for smoke, as a chimney, the evacuation route. This open air outside stair will go enter the building and will live here. So just one fire in the basement could put in risk all people, all occupants in the building, and would block all evacuation routes because all doors had wedges. But the thing is, and this is very interesting, from a risk assessment point of view, this was a good decision. And why is that? Because when we make a risk assessment, and in a very rough definition, risk is, and we all know this, a risk of a product of the severity by the probability. And the thing is that at that time, the probability of dying by COVID disease in Portugal was 10 times higher than dying due to a fire. And since the death toll is still counting, today the probability of dying of COVID is 40 times higher than dying from a fire. So, but the thing is, on the other hand, if there was a fire in the building, eventually, imagine 50% casualty in the building, so 20 people could have died in that fire due to wedges in all doors, which, taking into account that the average number of deaths in Portugal is 40 people per year, just one fire could increase the total yearly death toll in 50%. And imagine that this fire occurred with full occupancy of the building, and imagine that we would expect more than 40 casualties in this situation with all doors wide open with wedges. This would mean that just one fire would have so many casualties, so many deaths as 10,000 fires in Portugal, which is more or less the average number of fires we have in Portugal. So this makes me thought that, okay, this is a problem that we must look into very carefully. And once again, talking a little bit about risk assessment, and this is a conceptual definition that I use when I'm lecturing courses about risk assessment. I like to use in my classes this definition. Risk assessment is a way to predict the future by looking into the past. And the trick is we tend to look to the past as something that doesn't change. It's a very common expression. It's impossible to change the past. So everyone has said that this at least once. However, the past is always changing. In fact, one of the definitions of the present is the continuous change of the past. This seems eventually too philosophical for fire safety engineering, but it's very important concept. And when we have a black swan like COVID appearing, we are forced to speculate about likelihood of this event to repeat in the future. So putting this in more engineering wording, if there is an event with a very high severity, like COVID, we must make the assessment of its probability, as simple as that. So, well, it's, I would say, impossible to make a quantification on this, but we can make at least a qualitative analysis. So I tried to speculate a bit about the probability of this being a more or less recurrent event. And In fact, there was a huge scientific progress in the last century, last 100 years, and medical knowledge advanced a lot. So we kind of have an idea that we can control nature and diseases. But if we look carefully to this last 100 years, we can see that at the same time that we had a lot of progress on medicine and medical care, we also changed so many things in our lives that can facilitate a pandemic that, well, eventually we are not as safe as eventually we thought. So population growth is one of them. I'm going to talk a little bit in more detail of all these topics. Climate change and transport and globalization. So when we look to the graph of population growth, this is the last 2 centuries, and you can see that in a century we didn't grow that much, but in the last 100 years, from 1920 to 2020, we went from 1.9 to 7.6 billion. So it's a huge increase of population. This means more cities closer to each other, cities with higher population density, so easy to spread disease, it becomes easier to spread disease. We have megacities with more than 10 million, and they tripled in the last 3 decades. And this creates a sort of population continuous that facilitate the spread of diseases. And this is interesting to look as well. There are some regions in the world in which the population growth is much higher. So eventually, from this point of view, we can expect, and if we look to the last pandemics, and I'm going to list afterwards, they come from the areas or regions in which we had the biggest population growth. So, and another side effect is that urban areas get closer to the wilderness, so we are more exposed to wildlife. Concerning climate change, this map shows the average temperature increase in the last 50 years. So you can see here the increase of temperatures, and most of the world has been affected by this. This is a very complex phenomenon. It has a lot of interaction. I'm going just to name some very simple. Shrinking habitats that make wild animals get closer to urban areas in seek of food. Lower food resources make humans look into wild animals as a alternative food source, and we see that a lot in Asia. Shorten water supply affects public health and the hygiene of people and communities, which facilitate the spread of disease. Also, these extreme meteorological phenomena can cause generalized poverty and very strong wildland fires. So all these effects can facilitate the spread of diseases. And on top of that, we have much better transports, and we have globalization that has very interesting, good economic effects and knowledge effects, but it has a dark side as well. So nowadays in large cities, public transports are overcrowded, so this can rapidly scale a small cluster infection to a community transmission. Modern transports like cars, trains, etc., make it easier to travel from town to town or in different neighboring countries. So we can scale up very easily community transmission to epidemic level. and cheaper flights and more frequent flights can scale up the epidemic into a pandemic. So, and then we have the perfect storm like COVID. So all this put together, this was what we had like a century ago, difficult animal-human transmission. They were, wild animals were apart from humans. Level transmission between communities were very low, the transports were slow, so it could take days to go from one city to the other, so people would die before reaching the other city. So lower transmission inside the community because you have had lower density cities, so people were not so exposed to each other. And nowadays we have absolute the opposite of all I mentioned. So easy animal transmission, fast transmission between communities, inside communities, and in a very fast regional global transmission due to air transport. So, and we can see these when we look to recent epidemics and pandemics. So Spanish flu caused a lot of deaths. Well, this is a rough estimate, 50 million, but you must take into account that this was before the antibiotics been discovered, and this was just after the First World War, so it was a very good environment for such a death toll. But then we had Asian flu, more than 1 million deaths, Hong Kong flu, 1 million deaths, SARS-CoV, so this was past century, 20th century, and on the 21st, SARS-CoV epidemics, that was pretty much localized, so just 8,000 deaths. Then we have the H1N1 pandemic, 500,000 deaths in some. Well, this is the estimate of CDC is 57 million. So this is, there are higher numbers than this estimate. So then we had MERS pandemic or epidemic, to be more precise. The gray ones are epidemic, the black ones are pandemic, okay? And then we have COVID, more than 500,000 and still counting. So we had in just 20 years 4 pandemics or epidemics. This is not one for every 5 years because the first one was in early years of 20th century. So, but you can see that 7 years between, in average, 7 years between each of these pandemics or epidemics. And we also must, when we analyze this situation, we must understand how virus spread. So there is a direct contact with body fluids like hepatitis or AIDS, some with indirect contacts, small droplets in objects or furniture, then we touch and we take it to the eyes or nose or mouth, and direct contact with viral particles, airborne virus particles that are on the air. So the containment measures will vary depending on the type of contagion. So for a direct contact with body fluids, self-awareness, change of habits, protection device like condoms. Indirect contacts, we have hand hygiene, surface disinfection, respiratory mask, just to avoid touching the nose and the mouth. But when we have an airborne virus, then we have to have the full package. We must have social distancing, respiratory masks, home working, lockdowns that may impact movement of people, transports. We have confinement. So the impact in fire safety will always also vary a lot depending on these measures. So I would say in the first two cases, there is no impact on fire safety. But in a pandemic like COVID, we have a medium to strong impact, and I'm going to talk about it in the next slides. So I tried to summarize and put in different boxes all types of consequences that I came with. So we have temporary changes in the built environment. We have changes in our way of living, like social distancing, home working, maintenance restrictions, firefighting restrictions, and I'm going to look to all of them. So within the changes in the built environment, there are several types. Some apply to all types of buildings, door wedges, fire load increase. Well, this is an example of fire load increase, and this is one image that we all have from the media in the beginning of COVID, the rush for toilet paper. But we also have a decrease in occupancy load in most buildings, which can be considered to be good in a ASET, RSET analysis. But we also have some occupancy related, and I'm listing just the more relevant: hospitals and nursing homes, commercial buildings, industrial buildings. So the problem with door wedges, most obvious, is fire compartmentation if it is in a fire-rated door, and I have already mentioned this in the example I gave in the beginning. But this is not the only problem. It also jeopardizes smoke control effectiveness, and not only in stairwells and pressurization system, but also in large area with external doors if you hold them open. And this can jeopardize the effectiveness of the pressurization smoke control systems. And of course, there is also an advantage on having wedges on doors. It makes the evacuation faster because it doesn't require door negotiation. But these, and I'm going to talk in next slides, these don't really have a strong positive impact in total evacuation time. We have problems related to fire load increase. Most obvious one, alcohol-based hand sanitizer. It is very easy to ignite. And most countries have specific code requirements that vary according to the quantities. And what I have observed is that in some type of buildings, for instance, schools, they would have to store 200 liters to face the demand. So 200 liters in Portugal, this would require fire-rated compartments and metal containers and using fire-resistant or using a fire-resistant cabinet and ventilation. And most schools don't have any of these. So the thing is, most people are not aware of code requirements, and eventually they store these products without the proper fire protection. And this is very important to spread the word and increase public awareness. This is a flyer, an example of a flyer from CDC to healthcare facilities on the use of these products. So, and there is a lot of other goods stored because people were afraid of shorten the food supply and other good supplies in supermarkets or so. And once again, I come back to the toilet paper example. So concerning the decrease of the occupancy loads, during the confinement, we have lower occupancy load as obvious. So eventually this is good from the ASET, RSET assessment. But the thing is, we must take into account that the travel time, this only affects the travel time. It does have an impact on response time, recognition time, time to warning, and detection time. So this is just a small parcel of the total RSET time. So the total RSET. So the thing is, and eventually reaction time is the pre-movement is the biggest one. So these impacts won't be as good as eventually we would like them this to be. On the other hand, there is a negative impact as well, because in non-sprinkler buildings, we have left people to fight fires in the initial phase to use a portable fire extinguisher or fire hose reel. So fires, a small fire can very easily scale up to a very large fire because we don't have no one in the building to face the fire. So this is also a problem. Now, I have talked a little bit about general problems to all types of buildings. I'm going to look into some specific occupancy types. So here we have some basic drawings that try to represent standard plans of hospitals. They all have more or less this type of configuration of having a lot of wings that cross and have vertical circulation core, stairwells, and lifts. So this is very commonly functional organization of hospitals. And this is very good, and this came from, well, this is a very old solution, and this was specially designed also not only for functional and ventilation and lighting illumination problems, but also to, in case of a infection, we could separate one wing from the rest of the building and isolate infected people and separate them from non-infected. So we can split buildings in two, like we have, I show here with these red lines. And we can adjust these barriers a long time according to the needs. So if we have more infected people, we can change from the first position to the second, to the third, and so scale the space that we have to follow the demands. So, but this is something that can really compromise building fire safety. And because normally this is made with, and I forgot to mention, normally this is made to avoid the spread of airborne virus with physical airtight barriers. Okay, so this is a corridor in a hospital with one of those barriers. So these barriers can really compromise fire safety, and I have here a zoom from this very simple plan here. And we have the barrier here. So we had a two-way escape route. We had two available stairs, and with this barrier, we have just one-way escape route. And the thing is, travel distance may be exceeded, and in this particular case, they are, because once I move, well, if it was on the middle, maybe I could be code compliant if the one-way travel distance is just half of two ways, which doesn't happen in all countries in Europe. But in this situation, probably, and in Portugal, you wouldn't be code complying. We wouldn't be complying with code. So you can exceed travel distance. Horizontal evacuation strategy may become impossible because you have this barrier. Anyway, normally we don't do horizontal evacuation with infected people. And we also have problems with small control. This is a very common solution in Europe to make a smoke control in a corridor, to have alternate makeup air grills and smoke exhaust grills. So in this particular case, and in a very long corridor, I would expect to have 4 to makeup, 2 smoke exhaust, eventually 3 of each. So the thing is, with this barrier here, I have just 1 makeup air here and no smoke exhaust. So if I have the fire here, this would be truly problematic. And here, this side of the corridor is not as bad, but is not balanced. It's not properly balanced because you have much more smoke exhaust than makeup air. But imagine that you move this barrier to this position, then you would have in this side just smoke exhaust, not that bad, but on this side you would have double makeup air for the smoke exhaust, which would make the corridors to be in overpressure that could spread the smoke into the rooms where are the patients. So this is truly a problem that we must look very carefully. And anyway, fires in hospitals are very difficult to deal with always for several reasons. And in intensive care units, that's what we are talking about when we talk about COVID. Evacuation can be very complex because we don't want to evacuate infected patients to other areas of the building, and we need extra care to avoid contagion of personnel and firefighters. So all these factors can cause great constraints in a fire in a hospital. We also had issues with field hospitals. Can be made with tents, containers like this one, or inside buildings. This is a sport and events facility. This is in Lisbon. This is Lisbon's main hospital, and this is Oporto. And tents can be a problem. For instance, that they can create obstacles to aerial ladder trucks. For instance, if we had a fire here, it would be much more difficult for the firefighters to fight this fire due to these obstacles. And also when we use other occupancy type buildings and transform them into hospitals, we have a lot of problems and we don't comply with a lot of code requirements like travel distance, fire reaction of materials. These panels are not uncombustible, for instance. Fire suppression, it's not easy to have fire hose wheel here, and eventually the building is not sprinkler protected. Jumping into commercial buildings to facilitate crowd control in some commercial buildings and shopping malls. Some entrances were closed, like we see here in this image, to allow better crowd control, because we had limits of number of people per square meter. So like just 1 people for each 25 square meters in a supermarket, for instance. So we need crowd control. And to allow social distance in shopping malls, for instance, corridors and stairs have been fitted with signage like this one in floor saying you are not allowed to descend the stair. So this is to avoid people coming across with each other in corridors and stairs to facilitate social distance. So all these containment measures, although they are not in most cases physical barriers, this is truly a affordance issue. So this may lead to less efficient evacuation. And jumping to industrial buildings in a pandemic, transports restrictions, and this is something that I observed in Portugal, caused disruption in feedstock delivery. So factories had to adjust the just-in-time policy to deal with these delays in transport. So a very standard just-in-time storage is 3-week storage. And in some cases, factories had to increase the stock to 4-month stock. Mostly companies that the feedstock came from affected regions of the world, like China and Iran, for instance. So they had to increase a lot the stock in the factory. And of course, they weren't able to make complex improvements in fire protection of the buildings in which they operate. So the buildings were not prepared concerning sprinkler dimensioning and smoke control dimensioning. Buildings were not prepared to that fire load, that higher fire load. So another thing that I see in social media people discussing is how can social distancing impact travel speed? Well, we've made some simulations with same compartments, same number of people. In this side is no social distance, 1 meter social distancing, 2 meters social distancing, and you can see 39 seconds without no social distancing. And this can be 50% higher with 1 meter and 150% higher with 2 meters. But we can observe that the behavior of people, the elements, is unrealistic because people won't stop in the corridor or go backwards because they see a guy appearing on the door. So this wouldn't happen in a real fire scenario. So I would say that it's not expected that social distancing will have a strong impact in a real fire scenario. Another thing that I want to look was how the home working could impact fire safety, because if you have lockdown, people will work remotely. So, and the thing is, and this is common numbers, I would say, in all countries. In Portugal, 72% of fires are residential fires, and 86% of deaths occur in residential fires. This is the average from 2014 to 2019. So I thought that homework could potentially increase the number of residential fires because people would stay much longer inside their homes. But the thing is, when we look to statistical data, we must put this in a context, okay? So this is 2020, the first 6 months. So I'm comparing just the 6 months from 2014 to this year. And we have smaller number of fires until 2017, but this was due to the economical crisis. And when we compare the gross domestic product to power consumption to number of fires a year, you can see that they follow each other. So I decided to make the comparison only with 2018, the first post-crisis year, and 2019. And this red line represents the confinement period in Portugal from mid-March to the beginning of May. And this is very interesting. We see a decrease of fires during the confinement. And this is not very intuitive, but it was not in Portugal that this has happened. For instance, this is a very recent tweet from the London Fire Brigade saying that since lockdowns, fires caused by cooking under influence of alcohol dropped at 37%. And around 1 in 3 people who died in fire last year had alcohol in their system. So the concern that they were expressing is they opened the pubs yesterday. The concern was with opening pubs they would have more fires in residential buildings. So almost finishing, and I'm sorry that I'm going to finish with 2 or 3 minutes delay. Anyway, we will have time for Q&A. Maintenance restrictions, SFP Global made a lot of webinars and discussions on this. Fire protection systems must be maintained, properly maintained to avoid failure. And there are some restrictions due to pandemic that can compromise timely preventive maintenance, not only due to lockdown and movement restrictions, but eventually you may not have the spare parts, for instance, that are needed for some maintenance operation. But I would say that it is not expected that governments will want to have long confinement periods because this is terrible for economy. So they will prefer, as they are doing now in Europe, self-protection equipment, social distancing, and to avoid lockdowns. So I would say if a system is properly maintained, 2 or 3 months delay in maintenance, in preventive maintenance, it's not critical in a pandemic situation. Anyway, whenever possible, I advise to use remote maintenance equipment. That is not possible, of course, for a sprinkler installation, but it can be possible for instance, a smoke detection system. And also, occupants can be instructed to carry out some basic visual inspections. Firefighting restrictions, as I mentioned before, we must protect firefighters, but it's impossible to maintain social distancing in a fire scenario. So there were the need to divide firefighters in separate teams that never come across in any moment in the headquarters. So this allows less freedom in shifts and rest scheduling. Also, the need for respiratory protection masks also creates communication barrier with civilians. There are logistical restrictions in longer fire operations. That doesn't happen a lot in structure fires, but it can happen in forest fires that last for 2 days, 3 days, 4 days. So they have to eat in the theater of operations, but they have to maintain social distance, same things. They have to sleep in separate rooms. So this can create a lot of logistic constraints. And most of all, last but not least, very important, firefighters need to respond to several COVID-related emergencies. So this compromises a lot the readiness to attend a fire. So wrapping up this, pandemics with the magnitude of COVID is likely to occur in the near future, I would say. We may expect during a pandemic a reduction of fire events due to the impact of confinement and economic crisis. A lot of containment measures to contain virus transmission will impact can impact the severity of fires. Home working, remote working doesn't seem to have impact in the number of fires, but I would say these need to be studied more deeply in future months. And it is unlikely that social distance will impact or shorten or increase the travel time in a real fire scenario. Lower occupancy load won't reduce significantly total evacuation time. And this is my last slide. Containment measures may cause some restriction in in maintenance, but the impact doesn't seem to be critical. There can be some restriction to firefighting that compromise readiness for operations, and this can be problematic. And all changes in built environments due to pandemic, all these changes I've mentioned should be evaluated from a fire safety point of view, and in a lot of cases they are not. And in some more higher risk occupancy type like hospitals, nursing home, industrial buildings, large commercial buildings, I think we should make a performance-based assessment to see the impact of these measures. And this is something, a task that we all must have. It is necessary to raise public awareness of this increase of risk of fire due to the COVID containment measures. Thank you for the attention, and questions and comments are very welcome.
All right, thank you so much, Paulo. We do have a question, and just so that our listeners know, we do have about 9 minutes left, so feel free to submit any questions into the dashboard. So Paulo, our first question is, when do you think the Life Safety Code or International Building Code will change in response to the COVID situations that came about?
Well, that's a very good question, and my answer would be it varies and depends a lot on the country, because there are countries that respond much faster to code changes, and there are countries that are more bureaucratic and that won't happen. So I would say, and we are still responding to the needs of the COVID spread. So we eventually are not yet well focused in these side effects that I've mentioned. So I would say not soon. I would say eventually in some in countries where they respond very rapidly to code changes, 1 year, 2 years, other may take much longer. And there is something that is very important. Normally, some code changes are driven by fires with a high number of casualties. The only fire, and I forgot to mention during the presentation, for instance, we had a fire in COVID wing in St. Petersburg, in which 5 patients have died. So 5 deaths in a hospital fire, it's a very high number of deaths. We don't have casualties in hospital fires in Portugal, for instance. So I would say that this will vary a lot. So it's very important to increase the awareness of the public, but also the technical community. So we don't need a code to do things right, okay? We just need to know the problem.
Okay. All right. So at the moment, we do not have any other questions, but I just encourage our listeners to submit any questions. You can email them to me directly, and I will share with Paulo. So Paulo, thank you so much for a wonderful presentation. We appreciate your time, and this does conclude our webinar for today.
Okay, bye.
All right, thanks so much, Paulo. Bye-bye.